My name is Andrea Tolt-Freeman, and I am the District Director for Schenectady City School District's Pupil Personnel Services.
I'm Jessica Caravino. I'm a licensed mental health counselor for the district.
So our school responder model process, which we call our school-based diversion program, started a few years ago. There was at least a year-long process that involved a number of community stakeholders working on the project to design and really evaluate what we needed in our system. So people around that table and in that group included police, the school district, community mental health providers, county mental health, DSS, DCJS, probation. We had a judge on the committee. And really, there was at least a year's worth of work through hashing through some of the potential challenges. How should the model look? What are the evidence-based interventions that we should use? All in a goal to help improve outcomes for kids, eliminate the pipeline to prison, make sure that we are wrapping around children who have a behavioral health issue that may have led to some kind of poor outcome for them disciplinary wise. And we have established our own crisis prevention team here. So we have hired a psychiatric nurse practitioner that works for the district, along with two clinical social workers. And they make a team of 3, and they are called our crisis prevention team. They do things like provide a stopgap for services. If a student or family is struggling to get into a provider to re-engage in med management or needs therapy, and that was a huge need for us. And we've got definitely enough work to keep them really busy. I think the school responder model is really important for our school and for our students because our students tend to experience a lot of trauma. We experience a high rate of poverty in this city. We have kids and families who have high ACE scores in some cases. And we as a district have embraced a more trauma-sensitive model in which we're trying to design all of our systems to be more trauma responsive in thinking about how are we responding to kids and intervening before things become a crisis. Our kids and our families need us to be really preventative and proactive on their behalf in helping them to be successful. They face a lot of adversity. And disproportionality is an issue as well. We are very committed to making sure that race, economics, and disability are not predictors of student achievement, and that we are proponents of making sure that our students, especially our students of color, that we are providing an equitable system that is not having disproportionate numbers of students being either suspended or entering the criminal justice system.
I also think the diversion program is important for our students because it's looking at a prescriptive model. We're really taking a look at what is your risk factor, what is your protective factors, and how are we addressing that in a really prescribed way and in a team. It's the parent, the student, the principal, the school counselor, the social worker. It's a whole group of people kind of wrapping around the kid and not having a cookie cutter treatment plan, but something that really matches to what this student needs so that hopefully we don't see them come back through the doors of a superintendent hearing, and receive further disciplinary infractions. What we found is that kids who just get into a couple of sessions, obviously, and drop out, don't have, a good prognosis and as good of outcomes as kids who are connected long term. So we're taking a look at not just connecting you, but then how are we making sure that you're, following your treatment plan with your mental health provider? How are we supporting you in that? So the outcomes that we're noticing with our goals are that the students who are fully engaging, so those are the students and the parents that are coming to the table, they're completing their assessments, they're planning with us, creating that treatment plan and following through with interventions, are the kids who are rarely coming back for another hearing. So that we're very proud of that, and some of those kids we're kind of looking, now that we've been in the program for 2 years. We're looking at longer term data in terms of even how many suspensions are those kids getting, not just superintendent hearing, but we're trying to kind of unpack that a little bit more and look a little bit deeper, just how are they doing academically and behaviorally as, the further out they go from diversion. So one of the challenges that we faced in the implementation of the diversion model is family involvement. I think as we said earlier, the kids who have parents that come to the table and engage in the assessment and the treatment planning and the follow-up, what we call ERT meetings, are the kids who are successfully completing and are not coming back for superintendent hearings. The kids who, were struggling to get the families to the table, despite our best efforts of phone calls, letters, home visits, meeting with the students, those are the kids who were not able to kind of walk through the process and really get those good outcomes for. So family involvement is definitely been a hurdle. And in terms of what we've been doing is we offer a parent liaison to every parent, and those they will go out, they'll knock on doors too, they'll try to engage families, so that's one of the things that we've been doing to try to address that issue, so far. Mm-hmm. I think when we first started doing this, the anticipation of kids who would flag on the Maisie was quite low, right?
That's
I don't remember exactly. Maybe 20%
we
thought would flag.
Thought it would be 20%.
And I think we've had closer to
over 50.
Right. So I think a lot of the kids coming through our doors in the diversion program are kids that otherwise would have been earmarked for the juvenile justice system. They're kids who are having behaviors, that are masking other things going on for them. And I think because we have this program, we're able to circumvent that, and we're able to see them in a different lens and prevent them from going into the juvenile justice, system. And even if they're already in the juvenile justice system, working collaboratively to put the right tools in place to get them out of that system and get them where they need to be, whether that be mental health or another community-based provider. So I think that these are, again, we talked about the unlucky kids, right? Their behaviors are presenting in such a way that people are seeing them in a certain light. And I think, this has allowed our community at large to be able to see them differently and start to respond more proactively instead of reactively.
I think with diversion too, we've tried to, I keep talking about a full system that addresses the whole child. So we're looking at social emotional learning, competencies, we're looking at diversion, we're looking at crisis prevention team and our whole umbrella of trauma sensitive schools. When I think about just providing even our code of conduct. We've changed our code of conduct to reflect more restorative practices. We took things out like subjective language, like disruptive student things that lead to sometimes disproportionality. And so all of our systems are kind of working together, because I think just diversion by itself, is just one piece of it. We're trying to make our whole system really reflective of something that is less punitive, more therapeutic, more responsive to our student needs.